Hello, everyone, and thank you for tuning in to the second podcast in the 2016 to 2017 Tobacco Control Network podcast series. This is Lucy Longoria, Health Promotion Manager within the Health Promotion and Chronic Disease Prevention section of the Oregon Health Authority, and also the Tobacco Control Network Policy Chair. I'm joined today by Beverly May from the Campaign for Tobacco-Free Kids, Scott Hall from the Kansas City Chamber of Commerce, and Lila Johnson from the Hawaii State Department of Health. We're excited to bring you the second podcast, Tobacco 21, National, State, and Local Perspectives. So with that, I'd like to turn things over to Beverly May to provide us a national update on Tobacco 21 legislation. Beverly serves as the Regional Advocacy Director for the Western States and National Project Manager for raising the tobacco age to 21 for the Campaign for Tobacco-Free Kids. She provides support and technical assistance to state tobacco control coalitions and programs as they advocate for tobacco control policies and implement comprehensive tobacco prevention and cessation programs. Beverly, thank you for joining us on this TCN podcast.
Thank you, Lucy. I'm very glad to be here. I think it's important that we look at the fact that this was an emerging policy. And now we find that we have two states, Hawaii and California. We have Middle America, Kansas, that has just blossomed with all kinds of Tobacco 21 laws, and then we have the East Coast. So it's not one coast or another coast. It's all over the United States. We hit our 200 mark of cities and municipalities. And that was some time ago, so I know the number has increased. But I think it's important that we know why do we raise the age. And most smokers start before age 21. 90% of adult smokers begin smoking before they turn 21. Many smokers, they transition to that regular use during the ages of 18 to 21. There's a lot of studies out there about brain development now, and the idea of addiction up to the age of 25 or putting any kind of substance in the body during that age, the brain is still developing. So we know that is a transition to regular use. Nationally, 18 to 20-year-olds are twice as likely as 16 to 17-year-olds to be current smokers. Here's a quote from Philip Morris, and this was January 21, 1986. And it, quote, raising the legal minimum age for cigarette purchase to 21 could gut our key young adult market, that's 17 to 20, where we sell about 25 billion, with a B, cigarettes and enjoy a 70% market share. That was in 1986. So we do know that it is something the industry obviously thinks there's an issue because they were talking about in their own documents. Older kids are a source of cigarettes. 2/3 of 10th grade students and nearly half of 8th grade students say it's easy to get cigarettes. The older youth smokers, 18 to 19, which some are still in the high school area and associate with the ages, are a major supplier of cigarettes for younger kids who rely on friends and classmates to buy them. I have talked to some students to say when they turned 18, they received texts from younger teenagers saying, hey, would you buy me some smokes? So, I mean, it's not something that's not happening. More 18 and 19-year-olds in high school means younger kids have daily contact with the students. So we're trying to do an intervention where this is not something where they have the contact and they immediately can get the cigarette or tobacco products. Retail violations rates are low, so kids are getting their cigarettes from other sources. The key messages we want to make sure that's used nationally, state, local municipalities is the fact that we know tobacco kills more than 480,000 Americans each year. Virtually all of them started using tobacco before the age of 21. So delaying that onset is something we are looking at with this policy. Since tobacco is so harmful, we should do everything we can to prevent tobacco use among young people. Tobacco companies target kids. We know that. And they target young adults because they know that's when most users become addicted. And increasing the sale age will help counter tobacco company efforts to target young adults at a critical time of development. What was important for all the organizations working on this is that we are working on science-based information. It's not because it feels good, sounds good. We were very fortunate that the prestigious Institute of Medicine released a national report in 2015. And this report was quite detailed. It was about 600 pages. But boiling it down, what it's talking about is the data predicts substantial improvements in public health. The specific impacts over the long run would be reducing the smoking rate by 12%, reducing smoking-related deaths by 10%. And when you break that down even further, it's 223,000 fewer premature deaths, 50,000 fewer deaths from lung cancer, and 4.2 million fewer years of life lost. I think it's also important to look at the fact that this is not something that over the short term you're going to see enormous impact. This is a policy that takes longer, but it's delaying that onset, and you're going to reap enormous rewards as you have this policy in place. The benefits is delaying the age when people first use tobacco, as we've talked about, keeping tobacco out of school, and younger adolescents would have a harder time passing themselves off as 21. And it will simplify ID checks for smokers. You know, it's going to reduce smoking and save lives, and that's what we want to see happen. I will end with the fact that a law is only as good as the enforcement piece with the law. And so it's critical to have that enforcement elements in the law in the drafting phase. And you want to review the current laws to identify any weaknesses. You want to focus on the seller, not the buyer. You want to designate an enforcement agency for funding for the 21 versus 18. And this would be some of the areas that you would want to look at. So as we move forward, this particular policy is continuing to move. We have bills currently in Texas, statewide, and also in Washington State moving forward, and I know there's other ones in the works. So I want to thank you for this time. And Lucy, thank you.
Thank you, Beverly, for those important insights as to why raising the tobacco age to 21 is so important. Next, I would like to turn the floor over to Scott Hall. Scott is Vice President for Strategic Initiatives at the Greater Kansas City Chamber of Commerce, a business association representing more than 2,000 members throughout metropolitan Kansas City. In this capacity, Scott oversees the work on the Kansas City Chamber's Healthy KC project, an initiative in partnership with more than 150 Kansas City area organizations to make Greater Kansas City a destination for healthy living. Scott, please take it away.
Thank you, Lucy. First, I want to start with some context for everybody. Greater Kansas City is a metro area of a little more than 2 million people that straddles the state lines of Kansas and Missouri. And it is largely a red area of the country. Both Kansas and Missouri voted for Trump, and in statewide elections in this last November election cycle, Republicans dominated the statewide elections. And I say that to inform everybody that Tobacco 21 is an issue that is above partisan lines and can be brought to communities of all types and sizes. And I'm going to talk briefly about how we've brought it to the communities here in Greater Kansas City. As Lucy noted, this project is a part of a larger initiative we run here at the Chamber called Healthy KC, and tobacco cessation and prevention is a key part of that. Local statistics in Kansas and Missouri are sobering with respect to tobacco use. Youth and teen smoking is 14.9% in Missouri, exceeding the national average, and Missouri earned an F for tobacco prevention efforts in the American Lung Association's State of Tobacco Control in 2016. In Kansas, youth and teen smoking rates are at 10.2%. They earned the same sobering grade. Both of those percentage of youth and teen smoking exceeds the national average of 9.2. When we talk about Tobacco 21 on a local level, we always start in Needham, Massachusetts. And that's because Needham was the first city of its type to pass a Tobacco 21 ordinance. And the data that has been discovered since its passage is remarkable. In the first 5 years after passing Tobacco 21, Needham, Massachusetts saw a 46% decrease in teen smoking. When you hold that constant against 16 surrounding communities, none of whom during that window of time had passed Tobacco 21, you'll see a 26% difference, meaning Needham was reducing tobacco usage rates among teens at a rate that exceeded its neighboring communities by 25% just by passing Tobacco 21 ordinances. What's even more interesting is that this tremendous data persists. Smoking rates for adults in Needham are at 8%, 56% lower than the statewide average. The rate of smoking during pregnancy in Needham is 90% lower than the statewide average. Lung cancer is 24% lower among males and 33% lower among females in Needham compared to the statewide average. We use these statistics and others when we present in communities throughout the greater Kansas City area because it is a demonstration that you can have profound local public health impact by passing Tobacco 21 ordinances, both in the short term and maybe more meaningfully in the long term. One other statistic we frequently use, and I say this as a representative of the Chamber of Commerce, is a statistic that's out of Ohio State University, calculating the total annual excess cost of a smoker to a private employer at $5,816. And when you actually look at a detail of that statistic, you'll notice that there is actually a $296 credit, a pension credit, because smokers don't live as long as those who don't smoke, and therefore their employers don't pay as much in pension benefit because they die younger. Across the country, there are 211 cities and 13 states that have enacted Tobacco 21 policies covering more than 61 million people. And locally here in Kansas City, we are thrilled at the progress we've made on Tobacco 21 KC. We now have 21 cities in 2 states that have enacted Tobacco 21 policies covering more than 1.4 million people, and we have more than 165 local organizations supporting Tobacco 21 efforts through our Tobacco 21 KC program. Those organizations are big, small, health-oriented, and not, and represent a wide swath of greater Kansas City's business, civic, and governmental communities. To that end, we have offered on the wearehealthykc.com website some tools for other communities like ours, including an impact estimator that will tell you exactly how many lives will be saved if your community passes Tobacco 21. We also have a lessons learned document that will give you some of the tips that we have learned, in some cases the hard way, through our work on Tobacco 21 KC, and finally, our toolkit. We have endorsement forms, logos, fact sheets, and other resources that are available to anyone and everyone that wants to bring Tobacco 21 to their community. We couldn't do Tobacco 21 without a great collaborative of partners here in Kansas City and nationally. And we make ourselves available to any and all who'd like to bring Tobacco 21 to their community. And those people can contact me at my email address at hall, Hall, at kcjamber.com. Lucy, I'll turn it back over to you.
Thank you, Scott, for your local leadership perspective and for making those resources and lessons learned available to the rest of us. I would now like to introduce the podcast's final speaker, Lila Johnson. Lila is the program manager for the Tobacco Prevention and Education Program at the Hawaii State Department of Health. Lila has worked in tobacco control for almost 20 years, organizing coalitions, chairing conferences, and coordinating the statewide strategic plan. Thank you, Lila, for joining the podcast.
Thank you, Lucy. Hello, good morning. This is Lila Johnson at the Hawaii State Department of Health. I am the program manager for the Tobacco Prevention Education Program, and I'm very pleased to be able to share some information with you regarding the age 21 law that we passed in 2015, and it was acted in January of 2016. What was really important in how we passed the legislation is that it began at the local level. One of our counties, the Big Island of Hawaii, had already passed an ordinance in 2013. We attempted it on the island of Oahu, and unfortunately we were unsuccessful, but we were able to proceed with moving together at the state level. What was really important, we collected as much data as we possibly could, and one of the most important things that came out was the IOM report. The timeliness of that could not really have been better because it provided that evidence base, and the legislators listened to that very carefully. We worked closely with the Tobacco Legal Consortium all along the way in doing this. The community involvement was amazing. We had done an opinion poll, so we knew that the sentiment was very positive for it, and had been very positive since we'd had the issue on the Big Island. But involved with the community were the kids. Their voices were heard. They were the ones that had the poignant plea when they went and spoke with the legislators and indicated, because they would be the ones that would be most directly affected, how important it was to them. As I've mentioned before, we passed the law in 2015. The governor signed it in June of that year, but then it was not enacted until January 1st. And so it necessitated a great deal of work toward the implementation. We had to create signage. We had to contact the merchants. We provided materials to all of the tobacco vendors. We get our information from the Department of Taxation as to who sells the tobacco products. Also, for your information, we did include electronic smoking devices in the law. Media attention was wonderful. We were very, very pleased with a front page article. Actually, the article came out when the law passed, even before the governor signed it. So we had a fair amount of time where there was very, very positive publicity. With regard to the implementation and evaluation, we had a number of components that we thought were really important. As I mentioned prior, we really worked with the retailer merchant community. We also worked with the enforcement community. We met with the county police departments and the folks with the Liquor Commission, with them being aware how they would be informing their officers, and also what was decided would be for the first 3 months we would have more of an educational campaign, and then implementation of the law itself would be activated at the end of March. We worked with the educational system. We have one Department of Health throughout the state and also one Department of Education throughout the state. The superintendent of the Department of Education sent messages, official letters out to all the principals indicating that this was the law, and that also, possession of any tobacco products as well as electronic smoking devices totally contraband at the public school campuses. Hawaii is a state that depends very much on tourism, and it was a concern to us that what may happen when tourists would be coming from other countries and would be unaware of our law. So we created signage. We worked with the tourism agencies to provide materials. We translated materials into Chinese, Japanese, and Korean as well. What was also key was the issue with the military, because military are governed by federal law, so they really do not have to adhere to state legislation. We had worked for some time attempting to set up a meeting with the commanders of the various bases, because each base could determine what it wanted to do. And fortunately, what happened even prior to having the meeting take place is that the military decided that they would be totally compliant with the laws of Hawaii and would follow it. So our law is, bans the sale and the sale, purchase, possession, and use of electronic smoking devices, as well as tobacco products for anybody under the age of 21. So we think it's a true success with the military. It's not unusual, though, because the military at the highest levels is really looking toward having a much healthier service force. And so there were letters that came all the way from the Pentagon, and which basically promoted that. I have included with my slides a copy of the logic model, which determined how we're going to be evaluating it. And so these are the components as to what is going to be the economic impact, as well as the compliance with the community, with the military, with tourism. Some issues to consider is the current law, the current tobacco control laws, and preparedness. As I said, we had done opinion polls, so we felt that the community was solidly behind us for this, and the political climate. This happened to be a time with the chairs of the Senate Health Committee and the House Health Committee were very, very supportive and really helped shepherd this along. Merchant preparedness was important. As soon as the law went into place, they had signage, they had directions as to how to go ahead and implement this. As I mentioned before, the military argument, knowing that the military truly is supportive of smoke-free or a tobacco-free military for all branches, we were able to move with that. Enforcement and compliance checks. People often ask what is happening with that. We spoke with SINAR and the folks from SAMHSA, who said that Hawaii could definitely alter its compliance checks to include age 21. The decoys in the past have been under the age of 18, and so they said it would be, yes, we could go ahead and use age 21, but what it meant is we had to create new contracts with the enforcers, with the police departments, and the University of Hawaii, who conducts the stings. Data collection and evaluation, we have been doing that. We collected data prior to the implementation of the law, and we are watching it now. We are, almost into 1 year, and so we will be able to take a look to see, ideally we want to see tobacco use rates go down. We have seen some of it with tobacco sales. There's been a moderate decrease. It's not been truly significant yet, but we're watching it consistently. We're very pleased. We were pleased to help California and have them join the states in terms of states who have laws for age 21. Theirs took place in the middle of this year, but they had not much more than a month to be able to implement theirs, and so we were happy to share our signage and our materials with them. We really hope that in 2017 we will see many, many more states be able to push their laws through the legislature and enact them, because the science is behind this. This is really, really important to being able to decrease the purchase and the use of tobacco products by young people. So, mahalo. Thank you very much.
Thank you so much, Lila, for your valuable state perspective. That concludes this podcast. I want to take a final opportunity to thank Beverly May, Scott Hall, and Lila Johnson for joining me on this podcast. As a reminder, you'll be able to find all of the podcasts in the series and a host of other resources by visiting the Tobacco Control Network website, www.tobaccocontrolnetwork.org, and clicking on the Resources tab. Questions about the podcast series or any other features of the Tobacco Control Network website can be directed to the TCN inbox at tcn@astho.org. Thank you for listening and take care.